The Mesa Chamber of Commerce Inside Business podcast brings you a unique view of Mesa through its vibrant business community and the subjects that are important. The podcast is produced in the Mesa Chamber of Commerce Media Studio. Please enjoy this episode of the Mesa Chamber Inside Business podcast.
Good morning. This is Jeff Baer. I am so happy to be here representing the Mesa Chamber of Commerce and the Mental Health Subcommittee. We have an extraordinary guest with us right now, Dr. Diana Medina from Copa Health. And I've had the great pleasure of working with Dr. Medina over the years. She has a wonderful story to tell. And I think first, why don't we introduce you, say a little bit about yourself, and then tell us a little bit about Copa Health.
Sure. Thank you so much, Jeff. You are being very kind. I am Dr. Diana Medina. I am the Chief of Clinical Education at Copa Health. I have been an Arizona resident for many, many, many years. I like to say almost native, but not quite. Got my doctoral degree here and all my experience here, so my heart is definitely here. And I've had the pleasure of working at Copa Health for almost now 6.5 years. And so I'll start with kind of telling you about Copa, and then we can kind of go down the more niche part, if you will. Aspects of our organization. So Copa Health is a 501c3, so it's a non-for-profit organization based here in Mesa, Arizona. Copa provides an array of services, but mainly it centers around housing, healthcare, and employment. Now, Copa Health is a result of mergers with Mark Community Resources, which was established in 1957 here in Mesa, Arizona, Partners in Recovery, which was established in 2009, and most recently, Arizona Housing, Inc., which was established in 1995. So I mentioned that our three pillars in terms of continuum of care, which are housing, healthcare, and employment. And they're essential in stabilizing our most vulnerable community members. So you need to look at a sort of a holistic solution is more than just focusing on one of those aspects. You really have to focus on all three. So the first pillar that I'll discuss or, kind of explain a little bit about is housing. Because without stable housing, everything else falls apart. Our full housing pathway guides individuals from crisis shelter to transitional housing to a permanent home. So it's a wonderful place to get that foundation really strong, right? Then we provide healthcare services, and it really removes barriers to stability across the valley. Through our integrated health clinics, we provide full access to comprehensive services like primary care, behavioral mental health, and substance use treatment, among other things. And lastly, we tackle employment as our third pillar, and this creates really a path to independence, and I like to say also purpose in life. We connect people to job opportunities with wraparound supports, including training, coaching, and ongoing case management services. So we really try to help our members succeed in life.
That's a terrific summary of the background of Copa Health. Thank you so much for that. I wonder if you could tell us a little bit about the Copa Health integrated health programs, the clinics, and who they are for and what kind of services are available. They're really kind of unique in the industry, aren't they?
They are very unique. We base our clinics in that whole person model. We try to really service the whole person needs. So we provide primary care services, psychiatric care services, case management, counseling, peer support. We'll have a rehab specialist, a housing specialist. So we really try to provide everything in sort of a one-stop shop, if you will.
Well, one thing that is really impressive about the program is that several of the clinics also have a pharmacy.
They do.
So one of the things I thought over the years was really amazing is that the doctor could determine that a medication might need to be changed for, and Copa Health refers to their folks as members. So a doctor could want to change a member's prescription, and instead of that member who most likely is in there for, I believe most of those members are SMI, seriously
Right, correct.
So instead of sending them out on a bus to find the nearest Walgreens or CVS, they go right to the lobby.
Correct.
And they get, I'm telling the story that you should be telling Dr. Medina.
You're doing a beautiful job. Yes, it is that, idea of removing barriers to care. And like you said, if I go to a doctor and that doctor is working in isolation, whether it's primary care or psychiatric care, and let's say my medication changes or they prescribe a medication, you're correct, then you have to figure out how you're going to get to the pharmacy, wait often for that medication. How are you going to get home? And then if you have other needs during the week, during the month, how are you going to get to those appointments? So one of the goals of our clinics is to remove that extra layer of complexity, if you will, and make it easy. If the psychiatrist sees a need that can be addressed by our primary care team, they will walk you right over. Is that idea of warm handoff? Let's walk over there and see if I can introduce you to Dr. So-and-so and get the care that you need.
Really removing as many of the frustrations from the
Absolutely.
system as you can.
Absolutely. Absolutely.
So COPA is also known for its clinical education program, which you have been, as I understand it, the head of this program since its inception. So can you tell us a little bit about it and what makes it such a valuable experience for the folks that are in that program?
Well, in that program, and also for our members that benefit from the services, right? So I will, I will start from the beginning because I think it's really hard to tell the story without starting at the beginning. I've been in community mental health for, about 15 years now. And it has always been sort of a notorious industry to fill certain positions, therapy and counseling services being one of them. And in thinking about, okay, how can we address this need? Because the reality is counseling, and therapeutic services are an essential component of recovery, right? We can get medication to alleviate our symptoms, but if we don't learn how to manage whatever it is we're dealing with, whether it's depression, anxiety, PTSD, psychosis, it doesn't matter. We are going to be limited in how we can perform out in society, right? And so we went straight to the root cause and said, okay, we have a shortage of providers, or providers don't stay for very long. Community mental health is one of those fields that you either love and it's in your blood, or you decide, it's not for me. So we thought, how can we bring high quality services in a manner that is sustainable and it continues, even if the folks change year to year, and some of them stay with us for a long time, there will still be that need and it will be filled. And so about 6 years ago, we formed the psychology training program, which is a program that trains doctoral level psychologists here in the state of Arizona. And they actually come to us from all over the United States that want to work with our folks, which, like you mentioned, it's individuals in the SMI, seriously mentally ill system, folks with complex needs, and also individuals with developmental needs. So it's a really interesting and also an area that there is a lot of need for practitioners to really gain experience and competency in working with those populations. So we started the program. We started with, 3 interns and 5 doctoral students that needed to get experience. We also brought on board a couple of postdoctoral fellows who are folks who have finished their doctoral level degree but are getting extra experience and more specialized experience. And so we developed this program. We got accreditation, which talks about the rigor of the program and the experience that it provides. And so our members are benefiting from really excellent clinicians, excellent therapeutic services. All of our trainees are very closely supervised by a licensed psychologist in the state of Arizona. And our trainees are benefiting from gaining competency in working with these populations that it can be challenging to get experience in. They go out into the world, and something I like to say, Jeff, is one of my pet peeves is, when you call because you are at a low point in your life, if you call for help, right? Sometimes people will screen you and say, well, are you having thoughts of hurting yourself? I don't want any of our trainees, I think none of our mental health providers should be saying, well, if it's that severe, I don't want to work with you. And our goal for all of our trainees is that if they hear that, they're able to say, come on right over, I will work with you, we're going to get to a better place. And that is what they sort of provide to our members, but also they learn that yes, there is hope, there's evidence-based treatments that can be very helpful for the folks that we treat.
So you call these folks cohorts, right?
Yes, cohorts.
Explain that, and also I know that you must have just tremendous pride in how some of these students have gone out into public and private practice, and any idea of how many have come through the program to this point?
Right. So up to this point, we're over 70 folks have sort of graduated. And a cohort is our training year. So we operate almost like a school year, if you will, but ours is 12 months long. So it's from the beginning of August to the end of July. They are with us, they are providing services, and they are very motivated to learn. They are very motivated to work with our members and very motivated to help. And so that is always refreshing to see.
What is the impact of the training program in the COPA culture? How does that come together?
Right. Our trainees are part of the community. They are part of the clinics. They are team members, right? So they bring their expertise and their experiences with them. So in all of our clinics, we always get very positive feedback about having our trainees be part of the staff at that clinic, and then returning. Some of them return to us. You mentioned earlier, where do they go? Well, they go to all sorts of places. Some of them do stay with us. So we have actually two of our original trainees. They are still with COPA. And it is beautiful to see their trajectory and to see that here we are. We have providers that stay with us, right? And solve that, sometimes hard to fill either positions or getting the right professionals on board. So they go to, some of them stay in community mental health. Some of them do go into private practice. Some of them go and work for corrections and rehabilitation. Some of them will go and do a very specialized sort of treatment specialties, if you will, like neuropsychology or forensic psychology, and they work with the court system. Some of them go into education. So we are sort of spreading sort of the COPA way, if you will.
How do they get wind of this program? Because it's kind of isolated inside Mesa, Arizona. So how do they find out about it? And in a given year, how many applications do you get?
Oh, excellent question. So we have 3 levels of training placements that we provide. The lowest meaning the folks that come to us while they're still students, they're gaining experience. So they tend to come mostly from local programs in Arizona that are training professionals, psychologists. And so they will come and spend 16 to 20 hours a week with us and get that experience and then move along sort of their preparation in their program while providing services for our community, for our members. Then the internship level, and this is the one that really sort of broadcasts COPA across the United States. So we have a national matching system, very much like medical school. And so folks need to apply. So when you are doing research on what programs, what opportunities are there, when you click in Arizona, you're going to see COPA and you're going to learn about what we do. And so we have applicants from, on any given year, we have applicants, I can say, from at least 20 different U.S. states. How many applications we received this year? We received over 325 applications for 10 spots that we have to train.
That's incredible.
That is incredible.
You've done an incredible job with this program.
Thank you so much. It's the whole organization, right? I could not have done this if there wasn't support for the program, if the clinics and all the other, the great thing about our trainees is they touch the residential programs, they touch their programs, they touch training and education, they touch when we have a loss, someone dies, whether it's a member that has been with us for a really long time or even a staff member. They will provide grief support services for staff if they want it and need it. So they really try to touch not only our members, but also our staff.
That's beautiful. How can the Mesa community support residents who may be impacted by mental health challenges?
Yeah. I think sometimes here I go a little bit on my soapbox on reducing stigma, on viewing mental health just like physical health, right? If something hurts, we do not wait until it's totally and completely unbearable to go get help. We go to the doctor, right? If my ear hurts, I'm going to go to the doctor because I want them to check, is it an ear infection? Do I need antibiotics, right? So for physical health, it's a very, if you will, unbiased and clear path. Mental health is no different. And so removing the stigma, saying, hey, are you okay? Here's where you can go. And COPA is one of the many organizations in the Valley that provide services. Here's where you can go. The earlier we're able to intervene when there is a need in mental health, the more we can prevent crises in our community. Isolation is also a big component that really is detrimental for someone who's struggling with mental health. So if it's hard for me to get help, the more I am going to isolate, right? The more stigma there is, the more I'm going to isolate. And so to me, it should be simple, if I'm having problems with my heart is giving me, issues, I'm going to go to a cardiologist, right? If my stomach is giving me issues, I'm going to go to a gastroenterologist and try to figure it out. So if my mental health if I'm struggling, right, I'm going to go see a psychiatrist, I'm going to go see a therapist, and it should be as simple as that and as available as that. And we try to, at COPA, we really try to make that available for our community.
Well, I'm always impressed by the knowledge base that you have and what you do with it. And it's so impressive. I'd like to kind of close out here with any thoughts you might have on how, from your program standpoint, you're training and teaching people. And you just talked about if you have an issue with your heart, you go to a cardiologist. Where can people go for help if they don't know where to go? This podcast is with the Chamber of Commerce. So if there's a listener out there in a small business in Mesa that has a brother or sister that has an issue, and they are trying to get them help and trying to talk them into going for help, what advice would you give them?
Reach out. You can always start with your PCP. They will have some referrals. They can always reach out to Copa Health. Our website is copahealth.org. And it's a great place to start if for whatever reason, right, we cannot assist, we don't work with children, for example, right? We will then try to find out, okay, so here are some places you can go. I always say Access has a list also of providers that according to the plan that you have, they can send you to different entities.
And if you go to the Copa Health website, you can also go to the resource page, which would take you to Andy Arnowitz, who's kind of a renowned.
Oh my goodness. Andy is a walking encyclopedia, and this will age me because I know encyclopedias are obsolete nowadays. But absolutely, Andy has so much knowledge and he's so responsive to people in the community, to anyone really. If anyone has a need, a question on where to go to copahealth.org, resources, and reach out to Andy because he will point you in the right direction.
All right. Anything else you'd like to add before we sign off for today?
So have a wonderful day, and I'll come anytime. I can talk about mental health, removing stigma, about my program for hours and hours and hours. And so, I think it's really important to give to the community, and that is something that I always admired about COPA is not only are we providing services, but we're giving to the community, right? And being in this training sort of space. So we're providers, but we also train. And so we have this sort of dual sort of responsibility with the community. So
And you're just absolutely spectacular at what you do. So
thank you.
Thank you.
Thank you.
That was good to see you today.
It's great to be here. Anytime, Jeff.
Thank you.
This has been a Mesa Chamber of Commerce Inside Business podcast. You can find all podcast episodes at iTunes, Spotify, or your own favorite podcast website. You can also find them online at mesachamber.org. Content of this podcast is copyright the Mesa Chamber of Commerce, unless otherwise noted.